Okay. So last month we started a two-part lecture series about psychedelic interventions. And I'm just going to review some of what I touched on last time, which is what is psychedelic medicine. Psychedelic medicine is kind of an umbrella term that includes a lot of different types of drugs, mainly in three groups. Psychedelics include a range of substances. They all have strong effects on the conscious experience. So they affect your consciousness in some way. We're going to focus today on one of them, which is ketamine. Also, its derivative, S-ketamine. We're going to talk about both of those. Ketamine is kind of in a different group. It's kind of in its own category of psychedelics, and it actually started out in the medical world as a sedative. It was something that was used as a tranquilizer to put animals and people to sleep. I believe it started with animals and then went over to humans. If you've ever had oral surgery, you've probably had ketamine. Dental oral surgeons use it a lot in office to sedate people for things like wisdom teeth removal, tooth removal, things like that. So there's a chance you've had this. It's generally considered pretty safe, but we're going to go over that today. And it's an exciting intervention in the world of depression treatment. So I'm going to cover that too. I will give you guys time at the end to ask any questions, and we'll conclude. We have an hour, right? Okay, cool. So total of an hour. So psychedelic medicines work in different ways. Ketamine is considered a dissociative anesthetic. It is, as I said, typically was a sedative, but now we're using it for mental health. Examples of psychedelic drugs, all in the same kind of umbrella of medications, are ketamine, S-ketamine, psilocybin, MDMA, LSD, PCP, iboga and ibogaine, cannabinoids, which we commonly know as marijuana, ayahuasca, DMT, and mescaline. So ketamine is a dissociative anesthetic that has some hallucinogenic effects. It distorts your perceptions of sight and sound, and it makes it feel easier to feel disconnected. It is an injectable, short-acting anesthetic for use in humans and animals. It is considered a dissociative anesthetic because it makes patients feel detached from their pain and their environment. Ketamine can induce a period of sedation, feeling calm, feeling relaxed. It can also make you immobile. So some people have a hard time that like their limbs feel really heavy while they're under the influence of ketamine. Most people also have some amnesia. They may not forget everything. It does have an effect where higher doses completely removes your memory. But in lower doses, different clients report different things. Also notable is ketamine reduces pain. And I'm going to cover that in a few slides down the road, but for a lot of different types of pain, people report relief from that pain. And in some cases, it's pretty immediate, within 2 hours. So that is a huge plus right now, considering the opioid epidemic that is touching all of us. This can be a substitute or a way to wean people off of opioids. So that's really cool and promising. So ketamine is a mixture of two enantiomers, I don't even know how to say the word, enantiomers, okay? Ketamine is two of them. They're like mirror molecules. S-ketamine is just one of those. So it's very similar, but it has had one of those molecules removed. The product is a very similar product. Ketamine is a substance that typically has to be injected. So through an IV is a common way to do it, also called an infusion. That's how people use it as an anesthetic, and that's also how people use it for depression. This infusion typically takes you a number of hours. It's a half a day at least. You go in, It's usually administered by a nurse anesthetist, and it is an IV injection. There's a needle in your arm that stays in there while a bag of fluids is drained into your arm, and then you must stay in place for a few more hours. Most people report feeling really loopy and not wanting to leave anyway. Some people report nausea during this time. That's one of the common side effects. But overall, this process is a half a day, and patients often report relief that night or the next day. Some patients fall asleep that night, and so you really can't get a report, but by the next day, typically they feel better. And with ketamine, the first initial reaction is a good indication of how well it's going to work for your client. If you have a client that tries ketamine or esketamine, no effect the first time, that's not a really good sign. If they have 3 doses with no effect, the general advice is it's not going to work. This is not a recommended medication for them. But you will notice if you refer clients for this, a lot of them have a huge boost and improvement in mood after the first dose. There are maintenance doses required, but this is something that works in hours. The nasal spray, let me back up. Esketamine is typically administered as a nasal spray. It's also now, I understand, being administered as lozenges, but I'm not super familiar with those, so I'm not going to discuss those today. There is a nasal spray called Spravato. It involves esketamine, that is the ingredient, and it is FDA approved for the treatment of treatment-resistant depression. So this is available and on the market. Last month, I talked to you guys about psychedelic mushrooms, and those are really difficult to get a hold of. Your client pretty much has to be part of a clinical trial or leave the country for treatment. Ketamine and esketamine is much more available. There are a number of medical offices here in Memphis, Tennessee that offer ketamine. They offer the nasal spray or the infusions. The infusions can be delivered in 2 types of settings. One setting is a psychiatry setting. So those are usually run by medical doctors, psychiatrists, and nurse practitioners. But also there are nurse anesthetists that have infusion clinics. And one is called, I believe, Ketamine Memphis or Memphis Ketamine. There's other ones that are just called like Infusion Memphis or whatever. And they are places where you can go get custom infusions of all sorts. They offer like B12 and all kind of stuff. So both of these settings we're finding are offering the ketamine infusions. The nasal spray is typically offered in office at psychiatry offices. Now, due to the classification of this drug, it is considered risk for dependency. Ketamine is ketamine, we don't really know a ton about how ketamine works, but ketamine affects lots of different parts of your brain at once. And one of the studies that I read showed that it does affect the same receptors as opioids and possibly cocaine. There's the study they had clients take naltrexone and then administered ketamine, and it blocked the absorption in certain areas where opioids are absorbed. So the theory is it affects a lot of places in your brain, and it is susceptible to dependency if it was the kind of situation where clients were allowed to maybe take this on their own or have a prescription supply at their house. So it is not considered safe for that type of use. It is administered in office only. And there typically is a period of time that a medical professional is required to stay with that client. For the nasal spray, it is 2 hours. So it's going to be a pretty extended appointment for this client either way, but most clients report it was worth it. Typically for the nasal spray, they have to go in office, see the psychiatrist. The client can even do their own, I guess. The nasal spray is administered, and then they must be monitored for 2 hours by a medical professional. There are some side effects. I mentioned nausea. Agitation can also occur, so you are monitoring for that, and you also cannot let people drive. As I said, it's a sedative, so that's the other thing. The person can barely stand up. I mean, when they are under this, it's like they're very sedated. They are. The doctor's offices may use wheelchairs to wheel clients in and out after treatment. For the IV infusions, the length of treatment is hours, multiple hours, 6 hours, 8 hours. That's usually a whole day. And my cousin participated in a research study that actually used a hospital and let you come stay in a hospital bed to do it. So it's pretty heavy duty, the infusions. People are pretty impaired for the whole day. They usually go home, go to bed, but the next day report feeling a ton better and it being worth it. Also in that, if I mentioned, they have to be monitored after, same effects as before, nausea, and you can get agitation. There are some drug interactions too that you have to watch for. You do hope your clients are honest, but this medication can interact with other medications like opioids. Now, the cool thing about this medication is it does not interact negatively with a whole crap ton of psych meds. So this is something that you do not have to wean clients off stuff to start or to try. It also can be used to give an initial boost in mood while you're waiting for your psych meds to kick in. So that's really cool. It works. It doesn't have negative interactions, and it usually is complementary with most SSRIs and most mood stabilizers. Also, some of the other psych meds. It works with a ton of stuff. Not so much with opioids. But the infusion clinics and the psychiatrists that perform this do have to do a risk assessment and medication and all kind of things prior. Before a client will be approved for this anyway. So that would be something that hopefully the medical provider would handle with the client. But if you know your client is on a prescription pain medication, just part of informed consent, you could let them know like this may not be an option if that is your medication option. So, but they could work with a physician to wean off or take, I don't know how that works, but anyway, it's doable. I had a client who was addicted to opioid painkillers after an injury. And Vanderbilt was actually doing a research clinical trial. This was a couple years ago before ketamine was everywhere. And he got to be part of it as a way to wean off the pain pills. But it had to be planned and done well, like the timing. And he was one that had nausea and vomiting. They said that was part of the drug interaction. So anyway, he had a little bit of a rough go of it, but overall, it was still worth it for him. So let me get to my next slide, you guys. Sorry. Okay. How does ketamine work? I kind of mentioned it earlier. We don't really know. Some articles said it's really complicated to classify because it does so many different things. But one thing that Yale researchers figured out that's super exciting is that it can cause neurons who died as part of depression to regenerate. So this has a neuroprotective factor. What we have also found out is depression can cause cell loss. This medication is one that they believe can help actually rebuild the neurons that help the cells talk to each other better. I think that's why that's important. And it can help your brain recover from a depressive episode. Now, it works differently than other antidepressants. We'll tell you that. Okay, how is ketamine different? Typical depression medication regimens have not been improved in like 20 years, you guys. They have been kind of the same. You will have a new drug every once in a while come out, but it's still kind of the same protocols. So this medication works fast. It works within hours to a few days. Typical antidepressant protocols take from weeks to months to kick in. And you guys know that that is rough on our clients. And do you know what kicks in before the antidepressant factors kick in? All the terrible side effects, like the sexual side effects and the weight gain and the not giving a shit about anything. All that kicks in immediately, right? With our antidepressant medication clients. So it's hard sometimes to even keep them on the meds, right? So this can be something that is initiated at the beginning of the start of a medication protocol that gives them a boost that carries them over to the 6 weeks when that medication kicks in and starts working. This medication is also indicated for treatment-resistant depression. If you have a client that has failed on 2 other medications, this is an ideal client for this. It is indicated FDA approved for this, and if the client has had failure with 2 other medications, insurance may approve Is Ketamine Nasal Spray. The psychiatrist has to fill out some paperwork to get it done, but it is possible, which is really important because it makes it accessible. It can be prescribed along with a lot of other meds. I said that. Results can be drastically improved, more notable improvement than with standard protocols. So, okay, you guys know when y'all get clients and they're super depressed and you send them for a psych eval and they start them on psych meds, and 2 months later you do your Beck and Burns again and they're a little better, but like a little, just a little, but also they've gained 10 pounds and they can't have an orgasm, right? So you're like, oh God, like it's not even that amazing, right? That's not the case with ketamine. People come back and the symptoms are drastically different. The befores and after with ketamine are way different and way more drastic than a typical SSRI medication protocol or mood stabilizer protocol. There's also less side effects. Now, there is one troubling side effect that we just found out. Long-term use of ketamine, long-term use on a regular basis has been shown now to cause some memory issues, like memory issues not while you're being dosed with ketamine, which is probably not ideal. So I was just listening to some recent talks from the University of Columbia, I don't know, psychiatry department about the newest protocols on ketamine. And now they're saying use it at the beginning of your treatment to boost your other psych meds, use it to get people from suicide. We'll talk about that in a minute, but don't plan on this for long-term use. It was being used for long-term pain management. That's one of the ketamine clinic kind of things that they would do. That's kind of being recommended against now. Also, the efficacy of the doses does go down, it seems, over time. So you remember I talked about that first dose, they get that big boost. That's probably the best it's going to be. They're finding that there's different protocols and some have maintenance doses of monthly. The longer you stretch out that monthly maintenance dose, the efficacy kind of goes down. So it's not recommended for long-term use. It is recommended for severely depressed people who are in a funk, who have failed at other treatments. It is effective for a higher percentage of clients than SSRIs and mood stabilizers as well. Why is this important? Why is this medication important? It's important because in America, 20 million people a year suffer from depression, and 4 million of them have treatment-resistant depression. Suicide, I don't know if suicide rates go bananas. Like the veteran suicide rate, since I have been a social worker, has doubled. And I'm only 43, y'all. Like it can't double every 10 years I'm a social worker. Like it is crazy. This medication has been shown to reduce suicidal ideation and action. It's one of the only medications that we know of that does that and does it fast. So this is considered a breakthrough intervention for depression and the hardest depression to treat, treatment resistant. So it is a promising protocol, but it's to be used sparingly. Okay, it's not for. If you have money, you can walk in and get it. That is true. If you have money, you can walk into some of these places and pay $600 to $900 and get it. But as therapists, we need to be mindful of who we refer to it because of the side effects and the dependency factors as well. It's not, anyway, if they failed 2 other medications. All right, what does it feel like when someone does ketamine? What is the effects while the person's on the dose? A couple of minutes, very quick onset, a couple minutes, client's gonna feel maybe their heart rate going up. They will feel, they'll feel relaxed. They will feel disconnected from the world around them. Their pupils will dilate. They will have an eye movement, almost like dreaming. They can also be awake, but they can almost be in like a dream-like state. And you can even see rapid eye movements like you see in a dream state. It can cause nausea, as I said, and then it can also cause vomiting. So look out for that. What are the results? So the results are significant improvement in depression and anxiety symptoms. The severity of illness at 2 months, sorry, let me start over. There was significant improvement in symptoms of depression and anxiety after 2 weeks and after 1 month of a dose of ketamine. Significant improvement was seen at the first hour of the first dose when clients were diagnosed with depression. So very quick. Ketamine is a robust, in fact, rapid effect on depression, which is almost seen immediately and has been shown to be sustained for up to a month with 1 dose. Now, protocols are doing more than 1 dose. We love Dr. Pang's office. We have clients that we send there. They do ketamine with clients. They get it approved by insurance. They're amazing. What they do is, I think, 2 doses a week. So you go in for the nasal spray, and your first week, you come in twice. You get 2 doses. Your second week, you come in twice. And then I think they evaluate. And they do twice a week until you get to the point where they assess that they want you at. Then it's a monthly maintenance. So it's and I've seen the infusions like that too, where it's a little more frequently at first, and then they space them out. So, yep, kind of like regular therapy. You can see, I think after a month, you can see the return of some symptoms, but it's not like drastic. It's gradual return of symptoms, but you do see, if they don't redose, you will see return of some symptoms. Okay, here's the long list of all the things that ketamine is currently treating. FDA has only approved S-ketamine for treatment-resistant depression. FDA has also approved ketamine, but as a sedative. So a lot of these things I'm talking about are off-label use. Now, off-label use means that it is not an FDA-approved use of the drug, but it's still something in practice that is done. So this list of things, I Googled all the things I could get ketamine for in my area, okay? And so it's a lot. And this is the research, the evidence-based interventions I'm going to start with. So treatment-resistant depression, suicidal ideation, and severe PTSD with depression and suicidal ideation, okay? Now, these are all the other things that ketamine is treating. Anxiety disorders, bipolar disorders, opioid drug addiction, neuropathic pain, CRPS, cancer pain syndrome, phantom limb pain syndrome, fibromyalgia, neuralgia, OCD, diabetic neuropathy, pain syndrome related to stroke or trauma, migraine headaches, Lyme pain, pelvic floor pain, spinal cord injury pain, multiple sclerosis pain, eating disorders, including anorexia, bulimia, and binge eating, intermittent explosive disorder, social anxiety disorder, autism spectrum disorder, Parkinson's disease. Okay, so ketamine, as I said, if you have money, you can get it. I have no idea if it works for all this stuff, and I don't know if the places offering it have any evidence that it does either. But it's the kind of thing, the ketamine infusion is a very low dose. It's considered a very safe drug. It's not super risky. And some of these infusion places are charging $500 to $900 per dose. So it's a huge moneymaker. In Memphis, there's a doctor that opened ketamine clinics in Hollywood. And they did an article about him. It's a big cash money-making thing. So it's the kind of thing that your patients may not need a prescription from anyone. I don't know how they do it, but someone in the ketamine place prescribes the medication. But Infusion Memphis, they do it all there. You can just kind of walk in, and if you need, I don't know how this works. However, your clients can get, if they have money, they can get this treatment. We, of course, recommend referring your clients to reputable and safe psychiatrist because they're going to be a little more stringent than going to just the infusion places. But the infusion places are fast and quick, and I have had clients do both. Since we have found Dr. Pang's office, which makes it pretty easy and convenient, and he gets people in like a week, we've been sending people there, and that's been fine. Also, his office manager is getting insurance pre-approvals, but your clients may want to go to the ketamine infusion places. They may, but just keep in mind, helping them do informed decision-making. It is fully legal. As I said, it's fully legal. Clients can access this really easily. There are psychiatrists all over Memphis prescribing this. Oh, and there's a company, I mentioned earlier, the lozenges, that I'm not going to get into because I don't know, but there is a company doing teletherapy and home delivery lozenges. That's what our nurse practitioner told us. And I don't know how that works, but yeah. Ketamine is only FDA approved for treatment. Ketamine for treatment resistant depression. That's all I was going to tell you all about that. How can you get this medicine? Clinical trials at some universities are still going on. Some make that accessible because a client doesn't have to pay the big fees for this medication. You can also visit a psychiatrist, or you can visit an infusion center. It's very accessible. Okay, that's all I got. Thank you, guys. Do y'all have any questions or anything about ketamine? Have y'all had clients do it? Have y'all sent clients to get it done? Okay. Christine.
Hey, so I had a question about, you said that it is for treatment-resistant depression. We'll start from here. And, but I was wondering how that is if you're using it also at the, at the beginning of, or in place of other, like, you said before the other medicine, like SSRIs kick in, that you can use. So how is it treatment resistant if it?
Well, it's treatment resistant from what I understand is if it's if the other medications or other interventions have not improved the symptoms. So this may be their third round of medications or fourth round of medications. Do you see what I'm saying? Yeah. SSRIs always take 4 to 6 weeks to kick in from what I understand. So if they've tried 2, then their insurance will start to pay for this. So when they try their third SSRI, they can start it out with this to get the initial boost, the mood boost. Because what you're really fighting, what I learned through learning about ketamine is what ketamine is fighting is hopelessness. That's really the sell on this is what a lot of psychiatrists struggle with. And I think that you can probably even look at why people suicide is like the hopelessness that comes from treatment resistant depression. And this medication, because of the boost, like the initial improvement, people feel hopeful. And that's what I kept hearing psychiatrists say is like, this gives severely depressed people, because think about this, this is a client who maybe they got an SSRI, they waited 6 months feeling like crap, gained 10 pounds, it didn't work. Then their doctor said, okay, let's change it. So now we're on another one. We got another 6 weeks. This is now 3 months of feeling like shit. Now you gained 20 pounds and you haven't had an orgasm in 2 months. So like right there, that's the part that people are like, we need something quick. We need these doctors, like, we need something to come in here, get these people feeling better quick, because by now they're like defeated. Like they're like, no, I hate all this, So that's really the hope. Now, if a client is suicidal, a doctor may prescribe this off the bat. Like if someone is suicidal, which this is indicated to help, that client may, it's at the doctor's discretion, but it's really to offer the boost and the hope while waiting for other medications to kick in. Because this is going to be typically for clients who are on other medications and who have been on or tried other medications. Does that make sense?
Yeah. And there's no way, there's no understanding of how it works.
It works on a lot of, yeah, there are, but it works on a lot of different areas. And I don't know if anybody really knows how any psych meds work actually.
Yeah.
But they have found parts of the brain that it affects, but even still, it affects, there's a chemical that it improves that has to do with the way your brain communicates, I think. Glutamate, it affects your glutamate. Yeah. Okay. So at high doses, and here's another thing, depending on the dose, it affects things differently. At a high dose, it does something different at a low dose. At a high dose, it restricts glutamate. At a low dose, it increases glutamate. And glutamate is like a brain food, or I don't know, something for your brain that makes things work better. But it affects a lot of different parts. Like it affects the reward center in some way. It affects your opioid receptors in some way. And I don't really know how. And also, a doctor may be able to explain more. Some of the words, I don't even know what they're talking about. But it affects anywhere from 7 to 10 things at once, is what I found out. Anybody else have any questions? Are they doing ketamine at Lakeside? Does anybody know? I know they're doing transcranial magnet, whatever, something. Are they doing ketamine? Does anyone know? That would be like the perfect setting to do this if someone was inpatient while they're don't have to work or worry about it.
I don't know. I mean, I know Dr. Boyd supports it. He's done presentations on it, but I don't know that they were actually doing it.
If they're doing it or not.
Mhm.
We send people to Dr. Pang's office. They're fantastic. Now they don't do the infusions, but they do the nasal spray, and we've had great luck with them. And when I say Dr. Pang's office, it's Dr. Pang, but he also has nurse practitioners, and they're fabulous too. Dr. Pang is full, I think, right now, but we've had great luck with everybody over there. And their office manager, Jennifer, is amazing. She will get your clients insurance approved for nasal spray. And the nasal spray is, I think, $500 to $600 per dose. So when I say insurance covered, that's a big deal. It's thousands. Jennifer got we had a client that was suicidal, and y'all know I don't like putting people in Lakeside. So I had to do what I could to get her not to go inpatient, while still keeping her safe. Jennifer got her in the same day. They did, actually, it might've been the next day. It was like very, very fast. They did the nasal spray, saved her from Lakeside, but then Jennifer got like her whole year's worth of ketamine treatment covered by her insurance, about like $5,000 worth. So I cannot say enough good things about Dr. Pang's office. If you have a client that is desperate, suicidal, severely depressed, hopeless, they're fantastic. They're fantastic. Keep your clients out of Lakeside.
Are you saying pain or pain?
Pang, Jim Pang, P-A-N-G.
NG. Okay.
Mm-hmm.
I had one more question about so there's the long-term effects. This is not for long-term, what you said, right?
Yes.
So what constitutes long-term? Because I heard you say a year. I'm like, that's, to me, that's long-term. So.
I don't know exactly what constitutes long-term. This information just came out like in the past 6 months, and I don't know how long it takes before those effects happen. And also they're still looking into this, but I don't know. I did just watch a video from 2021 about like updated recommendations, and I can't remember if they said like a year. I don't remember if they gave a specific timeline, but they did say just not long-term use. Now, if y'all's clients go to the infusion place though, they're going to keep doing it as long. They're going to keep letting the client do it. So it's another thing that you want to make sure you tell the client this, like, hey, look into the risks, because there's clinics making a lot of money and they're not always going to be open and honest about these risks to clients. And they're not going to say, oh, you've already been here for a year. You shouldn't spend your $900, but we can be the ones that tell them, like, look into this for your condition. Because also if it's someone who's weaning off opioids, that has a long-term risk too. So, it's like weighing the risk, or I don't know, they probably need to talk to their medical professional about it. But if you send them to a trustworthy person, I think that should head off some of those concerns. The infusion clinics are not what I'm calling a responsible person. They are money-making clinics, but like a psychiatrist, I would say maybe just have a little more discretion.
Thank you.
I have a question. How does this work with people who are also struggling with like things like ADHD?
No impact that I know of. No, but I would wonder if there's like overlap with treatment-resistant depression, they're probably going to focus better when they don't feel so bad. So yeah,
they've got severe ADHD, but
yeah,
treatment-resistant depression.
yeah. So maybe if you can fix the depression, maybe the ADHD will be a little more manageable. Well, thank you guys for joining me. Good to see you, LaTracy again. How are you?
Hey, I was gonna jump on just to say hey.
How you doing? You still studying in school?
No, ma'am, I am now Dr. Aldrich.
Oh my gosh, Dr. Aldrich, I can't wait to tell everyone at work. Congratulations.
Thank you. It's been actually right about at a year now.
Oh my gosh, congrats. Where are you working? What you doing?
I'm still at the school, but I'm also taking clients too on the side. So
okay, well, we will fill you up, ma'am, because we don't have anybody who can take any clients and they keep calling.
oh,
So
okay.
email me your office number, because I think we filled up Vertava, and now somebody help us.
I got you. I'll email you.
Okay, cool. Well, congrats. Thank you guys. Y'all have a wonderful rest of your day. Reach out if y'all need anything. Okay. How do I just hit end?